Hello, this is Michael Dettner from On Life Health, welcoming you to this presentation on staying tobacco-free. If you have recently quit tobacco, or even not so recently, congratulations. You've taken a huge step to improve your health. You're also doing something that can be a real struggle. As a former tobacco user myself, I know how hard it can be, especially early on. Hopefully, this brief discussion will help you keep on the right path, or get you back on that path if you've hit a snag or two. It was Mark Twain who once said, "Quitting smoking is easy. I've done it 1,000 times." I think that's pretty obvious. After all, he is holding a cigar in this photo. The point is this. The vast majority of people who have successfully quit using tobacco have had to try multiple times before they finally got it right. In the next few minutes, I'll be giving you information about relapse. For instance, what it is and what it isn't, why relapse happens, how to avoid relapse, and what to do if and when relapse actually does happen to you. If you've made a quit attempt, but then returned to using tobacco, you've relapsed, right? Well, not necessarily. It's important to know the difference between a slip and a full-on relapse. Let's say that you've been tobacco-free for a few weeks. You're socializing, the temptation is high, and you bum a smoke from a friend. Afterwards, you realize it was a mistake. You might feel some disappointment, but you intend to put it behind you. That's a slip. A slip is a mistake. It means using tobacco once or maybe a few times after having quit. But you can correct it quickly. But be cautious. A slip can lead to a worse problem if you don't correct it. That problem is called relapse. A relapse is worse than a slip. It means that you've gone back to using the same amount of tobacco, or maybe even more, than you did before you decided to quit. A relapse is usually harder to reverse than a slip, but it is definitely possible. So, why do slips and relapses happen? One word: triggers. There are an infinite number of triggers, but most can be broken down into 3 categories. These categories consist of physical triggers, psychological triggers, and social triggers. Here are some examples of each. Physical triggers most often involve the unpleasant sensations and symptoms that you feel when your body is craving more nicotine. Luckily, these symptoms do get better within a week or two of having quit. Sometimes the taste, smell, or sensation of other drugs like alcohol or caffeine can contribute to a physical trigger. If you have associated tobacco use with meal times, hunger can also be a powerful trigger. People often use tobacco as a way to cope with difficult emotions or life events. It's called self-medicating. Examples of self-medicating or psychological triggers are negative emotions such as sadness, anger, fear, or anxiety, loneliness or feeling cut off from others, stress with work, family, or finances, traumatic life events like a death in the family or a bankruptcy, and sometimes just boredom. The third type of trigger is the social trigger. Social triggers are associated with other people in our lives. If you are normally surrounded by friends, family, or coworkers who use tobacco, this can trigger slips or relapses. Also, let's face it, social situations often involve the use of alcohol, which can be a very, very powerful trigger. There are countless ways to avoid slips and relapses. The important thing is to discover your physical, psychological, and social triggers and prepare for them in advance. For physical triggers, such as nicotine withdrawal, a very useful technique is called wait it out. In other words, when you feel a craving, remind yourself that cravings are temporary and surprisingly short-lived. Check the current time, count forward by 7 minutes, then remind yourself that the craving will be gone by that time in just 7 minutes or less. Surely you can wait it out for 7 minutes. Nicotine replacement therapies such as gum, patches or lozenges help reduce cravings as well. In addition, there are medications that can be prescribed by your doctor or, in many cases, even your dentist. For your psychological triggers, learn alternative ways to deal with negative emotions, stress, and trauma. Enlist the support of friends and family. Learn stress management techniques such as relaxation or journaling. And consider turning to a mental health professional to help you learn ways to get through the rough spots. Finally, social triggers can be especially difficult. Ask friends and family who use tobacco to step away from you if they need to use it. Avoid food and drinks that you associate with tobacco, such as alcohol or coffee. Substitute them instead with something else, like juice or tea. Remember, most people who successfully quit have had to make multiple attempts. The best advice is don't give up. So what happens if you do relapse? Well, think of it not as a relapse, but as a rehearsal. Every slip, every relapse contains profound lessons about what worked and what did not work. What's important is figuring out what helped you stay off tobacco and what worked against you. You can then use this information to make a stronger, more educated attempt at quitting next time. Go easy on yourself and don't get discouraged. Just because you slipped or relapsed does not mean that you are a failure. Avoid labeling yourself things like weak, loser, or failure. That just makes you feel more unpleasant, adding more psychological triggers. Remember your initial reasons and motivations for quitting. Do you want to quit for your health? To save money? For your loved ones? For your kids? Look back at what led you to the decision in the first place. Write it down and keep it with you if you need to. Set another quick date. Don't delay. The longer you wait, the more time you have to talk yourself out of trying again. And finally, ask for help. Let other people know that you're trying to do this. This keeps you accountable to them, and it allows them to be there for you. Consider talking with your doctor, health coach, or counselor for additional resources and support. And finally, one more important point. Overcoming tobacco addiction is possible. Millions of people have already successfully quit. You can too. For On Life Health, I'm Michael Dettner. Be well.